Welcome to Yours in Health and Human Services. YHHS is a program brought to you on behalf of the Rockingham County Division of Health and Human Services and is designed to provide the most current programs, services, and events for the citizens of Rockingham County.
Good morning, everyone, and thank you for joining us for our second segment of Yours in Health and Human Services. My name is Katrina White. I'm the Health Education Program Manager and Public Information Officer for Rockingham County Department of Health and Human Services. Today we are fortunate to have, or let's say lucky to have, Ms. Rebecca Oates. She serves as the Rockingham County Healthy Carolinian Coordinator. Welcome, Rebecca. And
Thank you, Katrina.
Thank you for being here. Today we're going to discuss, or the topic is going to be several topics, but it's all going to be genuinely focused on health and wellness. And so I like to title this segment as New Phase, New You. And so, of course, we know that October is National Breast Cancer Awareness Month. And so we wanted to spend a little time just to discuss about Rockingham County's breast cancer trends. And according to the 2019-2020 Community Health Assessment, the breast cancer mortality trends for Rockingham County from 2010 to 2014 compared to 2013 to 2017 was in 2014 24.3, and consequently in 2017 it was 19.9. Even though the numbers are going down, it is still important that we, as citizens, male and female, continue to practice those proper prevention measures that include self-breast exams, having your mammograms done annually, and to risk, your chances of developing breast cancer. We are fortunate in North Carolina to have a program called BCEP. BCEP is the acronym for the North Carolina Breast and Cervical Cancer Control Program, and provides free or low-cost breast and cervical cancer screenings and follow-ups to eligible women in North Carolina. You are eligible for BCEP if you are uninsured or underinsured, you're without Medicare, Part B, or Medicaid, are between the ages of 40 and 64 for breast screening services. That is a tongue twister. However, if you're between the ages of 21 through 39 and you're having some type of breast issues or something like that, you will be eligible for the program for the screening, the exams, or anything that may follow. Also, there is a income eligibility requirement, and having a household income at or below 250% of the federal poverty level. Rockingham County Division of Public Health has an excellent BCEP program, and they see patients on Tuesdays by appointment. And for more information about our BCEP program, you can contact our BCEP coordinator. Her name is Marnie Atkins, by calling 336-342-8140. Also, there's a community program provided by Annie Penn Hospital. Let me change that. It's now Cone Annie Penn Hospital, and it's done through their Annie Penn Hospital Foundation, which is a partnership with All Light Foundation that allows folks without insurance or provider to get their regular mammogram through a scholarship, and no one should be without access to the screening. So this is very important to us as a community and community partnership. We also want to talk about Phase 3 and the reopening of the businesses, venues, and other areas in the community where, citizens sort of congregate. With these new lifted restrictions, people are becoming more social. There are more social gatherings, and people at some point in time, they kind of have this COVID fatigue, so they're over it. Right? However, it is very important for us to continue, even though it seems as things are opening up and areas are increasing, so will the COVID cases, unfortunately. So we have to be really diligent about remembering, not only remembering, but practicing our 3 Ws. Wear your mask, wash your hands, and wait at least 6 feet apart from other people that is not part of your nucleus or your core family members. And also, what is very important at this time of year, we're going into the flu season. And the flu season on top of a pandemic can just, result in very, very, maybe traumatic or fatal, consequences. So we have to be mindful of our practices to keep ourselves safe and also, protect the safety of others. Rockingham County Division of Public Health hosts a annual flu campaign, and that's open to the community as well as employees of Rockingham County. Unfortunately, because of COVID, we cannot have a more robust campaign as we had in the past, but we do try to provide the best resources for our citizens. This year, our flu campaign will start on October the 6th. And we're going to limit, because of COVID, as you know, we're going to have to limit the access and try to just be mindful of spacing and safe environments. So we're going to only offer the flu clinics on Tuesdays and Thursdays from 9 o'clock to 4:30. Unlike before, instead of individuals coming to the clinic, the health department is going to be a drive-through type event, and so individuals are encouraged to just come drive through. It's going to be here on the campus of the governmental center, and the exact locations will be designated, by signage and other literature. I wanted to also reiterate that if there are individuals that are coming, and maybe let's just say you have 5 or more individuals in your vehicle that's also requesting a flu vaccination, please give us a call ahead of time so that we can keep the line moving. Also, if you're a parent of a child that's particularly anxious about vaccinations and things of that nature, we request that you would give us a call prior to and make an appointment to come inside the clinic. There are a list of insurance carriers that we do honor. However, there are some that we don't. And you can get more information about that if you want to give me a call. My name is Katrina White, and my number is 336-342-8150. However, if you're not covered by insurance, Medicare, or Medicaid, there is a fee of $30 for the vaccine. So again, please just give me a call for any information, whether it is about the flu vaccine, your eligibility, or to make an appointment, and I will route you in the right direction. So we've discussed about those 2 initial things we can do to kind of keep ourselves healthy in the new phase and being the new you. Now I would like to turn it over to Rebecca so she can tell you a little bit about some of the health and wellness initiatives we have in Rockingham County.
Wow, thank you, Katrina. Thank you for all
welcome.
that. So we'll start off, we'll talk about the Be Healthy group here in Rockingham County. So it's an organization or a group that's targeted towards physical activity and nutrition initiatives within the county. And something that we're working on right now is a virtual walking challenge. So it helps us to maintain social distancing while also promoting physical activity for our county citizens.
That's great.
So something that you would do, so you would register for it, whether you want to register individually or as a household, so your family can register together. And so you go out and walk together. So for every 10 minutes that you walk, you get a point. It's a 4-week program, so over those 4 weeks, you tack up your points for every 10 minutes that you walk.
Yeah.
At the end of those 4 weeks, you turn it into myself or my colleague Jordan Jeffries James, and we'll tally up the responses. It's kind of a healthy competition that
I
we're
like
creating
that.
here.
I like that.
And there will be some incentives and things that we'll be giving out at the conclusion of the event as well.
Wonderful.
So we're just waiting on a couple of semantic things to get smoothed out, and then we will be announcing our start date and our end date. Again, it'll be a 4-week program, but it's something that we're very excited to offer our Rockingham County citizens.
That is very exciting because people have just been so enclosed for so long, to actually get out and participate in some fun physical activity. Actually make it a sort of competitive, if you
Yeah,
like.
exactly.
So that's very exciting. Thank you.
Yeah,
Thank you
of
very
course.
much. What other health initiatives do we have going
Yeah,
on
so
here?
we have our student health centers. So something that we as health educators do is we go into the 4 high schools here in Rockingham County, and we provide health education to the students there in a one-on-one session. So some of those initiatives could be physical activity and nutrition, sexually transmitted infection education, family planning, abstinence, and smoking prevention. And it's different on a case-by-case basis based off whatever each individual child is interested in or needs education within. But it's really nice to connect with the youth of the county and to provide, again, those education initiatives within those settings.
Wonderful, wonderful. And I also wanted to share some information that we had about an initiative we have. It's called Safe Sleep. It's actually a program that has been funded by the Women's Health Branch at the state level. And what we're trying to do is decrease the prevalence of SIDS, or sudden infant death syndrome. And so what it is a 1-hour, one-time class that talks about the importance of back to sleep and up to plays, and the importance of putting the baby on their back when they're asleep. There's a lot of detailed information about that, and we just kind of cover all the bases as far as myths and what is actually accurate, according to science. And because of the funding we receive, individuals can receive a $25 gift card as an incentive for you to come and learn more about how you can protect your baby. Another class that we offer is smoking cessation classes. And the smoking cessation classes is twofold. We have a class for the general public, and we also have a class designed for female caregivers of children under the age of 1. And so depending on which category you fit in, this is a 4-week program. It lasts 1 hour a week for 4-week series, and so there are incentives that come along with that. And we offer a lot here at Rockingham County Division of Public Health Education Program. And so I also wanted to mention our diabetes and chronic disease self-management programs. As you all know, that Rockingham County has a high prevalence of diabetes, and so we're trying, in collaboration with community partners, including the Rockingham or the Diabetes Task Force of Rockingham County, we're trying to strategize and turn the tides with diabetes and individuals either developing diabetes or at risk for developing, diagnosed with diabetes or at the risk of developing diabetes. So the chronic disease and diabetes self-management class is a 6-week series, and it's once a week, every week for 6 weeks for 2.5 hours, where we discuss everything from diets to having that important conversation with your physician, family support, everything that you would need to successfully handle your diabetes situation. So with that being said, is there anything else you would like to talk about, Rebecca? Well, actually, I'm so sorry. When I was discussing the flu campaign, I failed to mention that we're offering, a flu clinic for county employees or governmental employees. And so normally in the past, we've had a 2-day session to try to accommodate everyone's schedule. However, with the pandemic and the other situations at hand, we can only offer a 1-day clinic. That would be held on October the 28th from 9 o'clock to 4:30. And let me get through here. And that will be located in the large conference room on the, which actually on the second floor, but we used to call it the kitchen for many years, but it's now the large conference room. And individuals are asked to bring their identification card or an ID badge, their insurance card, and if you're unable to make it to that particular clinic on that day, you are still eligible to, utilize the drive-through process. However, unfortunately, we cannot allow, or we don't have the necessary atmosphere, if you will, to to allow any walk-up vaccination. So you still will have to use your vehicle and drive. And again, it can be more than one person in the car. So if you have any questions, again, feel free to give me a call. Katrina White, 336-342-8150. And there will be additional information coming out to the individual departments and employees in the near future. Okay. So Rebecca, I'm sorry to interrupt to add that, but anything else you would like to share?
Yeah, so just towing off of the diabetes self-management class, we do have a minority diabetes prevention program. It's a year-long program, and I know that sounds daunting, but it's really, really fun and something that I'm really excited to immerse ourselves in again. COVID having had postponed, the start of the new class and everything, but it's aimed at changing your lifestyle to prevent type 2 diabetes. So most of your classes they're all different. Each class is different each week. They focus on how to make better food choices, become more physically active, and finding ways to manage problems and stress that may, cause you to, fall off the wagon, so to speak. So it also creates like a community as well. You have the same, whenever you start the class, you have those same people that stick with you, hopefully through those 52 weeks. And so it creates like a small little community where you can talk to people. If you're having issues with, one aspect, you can bring it to the group and we can discuss it together and try and tackle anything, any obstacles that you have together. Totally judgment-free zone. We're all there for the same reason, and we're there to learn and learn from each other, learn from each other's experiences. And it's really, really fun and something that I'm very excited to start offering again.
Yeah, and I've facilitated a couple of minority and diabetes prevention programs. And like Rebecca said, it is more like a fellowship. People feel comfortable, they come together and they discuss their wins, and we pride them on their wins, and they also have a chance to openly discuss their struggles and get different opinions about that and how to overcome them, because diabetes, like with any other chronic disease, you're going to have your struggles, and you're going to have that time where you really want to feel like it's too overwhelming, I just want to put my hand in the sand and just be done with it. But that's not actually the proper way to handle the condition or your situation. And a great thing about DPP or MDPP is that the main focus is to, reduce your weight by 7 to 10 pounds throughout the process, and also at least try to get 150 minutes of exercise weekly. And these things are recorded, and we guide you with your meal plans, or not actually with your meal plans, but there is a ledger, if you will, where you have to document. I call what you bite, you write. And so you sort of, just kind of log your meals, each meal a day. And we, as coaches, will actually look at it, and I want to share a disclaimer. We are not dietitians. We are not nutritionists. We are coaches that just try to help you along your way. And so we will actually monitor and suggest different things that you can do, and to help you be more successful. So we are really, really excited about this, and hopefully we can bring a new series to you really soon. Okay. Thank you so much, Rebecca. I'm so happy to have you here today and sharing this wealth of information. We've really given, I hope we've given the community some resources that they can consider. And to the citizens out there, and everyone in Rockingham County, thank you for joining us for yours in Health and Human Services, and have a wonderful weekend. Bye.